Le jury est réuni aujourd'hui dans le cadre de soutenance de thèse de M. Mohamed Saoudi pour l'obtention du diplôme national de docteur en médecine dentaire. Veuillez, M. Mohamed, nous présenter un bref résumé de votre travail.
Thank you, Mrs. Jury President. Before I start my presentation, I want to thank our honorable jury for accepting to assess our work and thank my thesis supervisors for the support and collaboration. Now I will start the presentation of a brief summary of my thesis entitled How to Manage Post-Removal in Case of Prosthetic Failure. My presentation contains 9 sections. Here is the plan. I'm going to start with the introduction. The use of posts in the prosthetic rehabilitation of pulpless teeth has always been the first resort of the dentist, due to the advantages they add to ensure the success of the prosthetic treatment. However, some cases require a re-intervention. This study will help clarify the potential controversies of this topic and set some solutions and methods to handle different clinical situations when it comes to post-removal. Biological and mechanical properties of pulpless teeth. Most dentists believe that pulpless teeth are more fragile than healthy ones, which is not always the case. Many studies have shown that endodontically treated teeth and vital teeth have the same biomechanical properties such as toughness, hardness, punch shear, strength, and load of fracture. We know that non-vital teeth endure higher occlusal loading due to the absence of neurosensory control. Sometimes the extension of the endodontic cavity might cause the tapering of the cervical walls, as we see in this figure. This figure displays the results of a study that concluded that the more a tooth is decayed, the weaker it becomes. The preparation of a post space could cause perforations as well as fragility in parts of the canal, which compromises the root structure. Now we move on to the second section, posts and cores, why, indications, contraindications, and why are posts and cores needed. A post or a core is indicated when a large part or all of a tooth's original crown structure has been lost. If enough natural tooth structure still exists, then no coronaradicular constitution is needed. Now, post contributions in the prosthetic rehabilitation. It ensures a fair distribution of the functional load on the crown and the root, enhances the retention of the prosthetic system above, preserves healthy dental tissue as much as possible after eliminating the decay. It allows the practitioner to re-intervene endodontically in case of need, tracks the same shape of the root, partially restores the invalid crown shape while remaining as aesthetic as possible. It helps with the success of the endodontic treatment. It guarantees the tightness of the apical portion of the root. Now the criteria of a successful coronaradicular constitution. The tooth has to get an appropriate endodontic treatment. We should make the necessary radiographies and clinical examination in order to make the correct diagnosis and adopt the suitable therapeutic plan. The straighter the root is, the easier is our treatment and success chances are higher. The post axis should be along the long axis of the tooth. After a review of the literature, fiber post systems appear to be favorable alternatives to metallic or ceramic post systems. We should preserve as much dentin as possible. It is essential to mention that most etching modes significantly influence the nano-leakage of universal adhesives, which requires a good selection of the post seam. And finally, we must keep in mind that the less space is prepared, the more resistant the tooth is. When it comes to post removal, we should start by mentioning the parameters to consider before removing the post. Indications. Every tooth that has a defect in the endodontic treatment or filling or any periapical complication requires the removal of the post. As for prosthetic considerations, such as wrong orientation of the post axis, insufficient length and diameter of the post, poor cervical adjustment of the post, or fractured post, and of course aesthetic considerations. Contraindications of post removal: high risk of fracture, non-favorable root-crown ratio, or high cost of the removal with an acceptable prosthetic reconstitution. As for periodontal contraindications, tooth mobility or poor periodontal state. And finally, patients with infectious or hemorrhagic risks and those with low socio-economical status. Post-removal techniques. We divided them into, first, traditional techniques and contemporaneous techniques. We start with the traditional techniques. Macer and kit technique. It is simple, it does not generate heat, risks of fracture and perforation are limited, and no excessive forces are applied. Endo extractor kit, it is similar to Macer and kit device, made from stainless steel, and it is sterilizable with autoclave and dry heat sterilization. Clavilex system. It's not a crowding device, which makes it easily used on posterior sector. However, there are risks of fracture or perforation. Igler post removal. It works similarly to gun-on post removal, which we will describe later on. It is used especially when the post and the core are cast as one unit. However, it's recommended to avoid its use on screwed posts. The Radel post removal system. It combines the characteristics of gun-on and Thomas kits. Along with removing parallel or tapered posts, it could also depose screwed posts. It might be used in the withdrawal of separated instruments in the coronal portion of a large canal. Post puller. This system is characterized by its safety and efficiency. Risks of fracture and perforation are low. It is used for both manufactured and anatomic posts. Nevertheless, its use is limited because of its size. It can't be used on posterior teeth and those with low mesiodistal diameter. Antagier puller. It has the same principle of use as the post puller. Sacapino post extractor. It is an efficient and safe technique for removing a cemented post. Clamps. There are three types of clamps. There is stigless clamp, needle holder. It is a good instrument to grip the post and reduce the risk of it slipping or rotating. And finally, orthodontic clamps. They were used to remove screwed posts to screwed posts. Now we move on to contemporaneous techniques. We start by ultrasonic techniques. Universal ultrasonic sickle insert. It can be used in simple cases of daily dentistry. It's also called the scaler. RotoPro rotosonic scaler. The vibration of these bores represent a simple method with low cost to loosen and depose an entirely exposed post. Kit Pro Ultra Endo. They are smooth inserts made of diamond and should be used to maximum power and water spray. Satelec Endo Success Retreatment Kit. They produce a powerful ultrasonic wave through the whole axis of the post. The vibration effectively splits the sealing cement into fragments, which eases the removal of the post. Mini Master Piezon. It's used without air or water spray. That's why the ultrasonic vibrations are applied continuously in all directions for up to 15 seconds at most to prevent the excessive forming of the surrounding dentin. Now the second contemporaneous technique, it's gun-on post remover system. It is fast, easy, and efficient, and can be used on all teeth. The system is available with trephines that have anti-clockwise threads, which eases the removal of the screwed post. However, it might have some difficulties when removing posts in the molars, especially if the intramaxillary distance is limited. In spite of all the techniques that we possess, we dentists are always confronted with complications and failures. Complications that are linked to the post. The post-fracture is usually due to an excessive use of force and a wrong removal access throughout the extraction. Sometimes the risk of fracture or failure is so high that we have to consider a change of treatment strategy. And here are some recommendations to avoid these problems. First, analyze the case and make the necessary radiographies and exams to adopt the most suitable treatment. If failure is imminent, it is safer to lead a different course of treatment. And we have to prefer ultrasounds as a removal technique because they usually are the safest and the most efficient. Dental complications. Fracture and fissures, they can be caused by the removal protocol or might even exist before the post-extraction and are directly linked to the dentin thickness. Perforations have iatrogenic causes, usually they're due to an error throughout the removal. Dental weakening is an inevitable outcome to the use of abrasive instruments, ultrasounds, and dental drills. The extraction can be described as a historical complication. It might occur if the removal is done on teeth with weak periodontium or the application of inappropriate traction or rotation. Periodontal complications: necrosis, ankylosis, and resorption. In this section, I'm going to present a case report published in 2007. It's a case about a 42-year-old female that presented with necrosis of soft tissue and bone surrounding the maxillary central incisor, as it shows on the radiography on the left and the clinical appearance on the right. The patient stated that her dentist made a vigorous attempt to clear the cement from the canal with an ultrasonic instrument. The conclusion was that the heat produced by the ultrasonic vibration is probably the cause of the damage to the alveolar bone, gingiva, and nasal mucosa. We finish our study by insisting on respecting some instructions in order to prevent any complication or possible re-intervention. First, we have to make an appropriate endodontic treatment and make an appropriate clinical exam with the necessary radiographies. Avoid metallic posts and cores whenever possible. Due to the high risk of fracture when ceramic posts are used, it is better to adopt fiber posts. It is advised to do the post preparation in the same session of the canal. Cement the post along the long axis of the tooth. Use waterproof root cement before filling the post. Choose the post with an appropriate shape, diameter, and length depending on the clinical situation. Preserve as much dentin thickness as possible. Try to keep the post space preparation as low as possible and ensure the best retention of the post. Conclusion. We insisted in the study on the value of succeeding the endodontic treatment and the coronaradicular constitution. Actually, we might avoid possible re-intervention just by respecting and following some recommendations. However, the removal of the post is required in many cases. That's why it is important to know how to handle complications when they occur. Luckily, we possess a great arsenal of systems and equipment to achieve the removal the best possible way. We just have to make the right diagnosis and combine the appropriate techniques to reach a satisfactory result. And thank you for your attention.
Merci, Monsieur Mohamed Saoudi, pour la qualité de